Today we are going to talk about a very delicate subject. What is the limit in the pursuit of the perfect body? The imposition of beauty standards that we see in various media is creating a dangerous conflict between aesthetics and health. The pursuit of plastic surgeries, restrictive diets, excessive physical activity, and the use of thermogenics that promise to burn fat is gaining significant traction and market among those seeking the perfect body. And amidst this scenario, there are medications that promise to aid in quick weight loss. But have you ever stopped to think, what is the cost to our health when we use these medications?
Let's find out if this substance, which promises to aid in weight loss, really works. We're talking about Sibutramine, or Meridia, as it's known in the United States. Its risks and benefits.
Does this substance really work? Can using Sibutramine cause physical or psychological dependence? We will hear the opinion of a doctor and the testimony of those who have used Sibutramine or Meridia, as it is known in the American market.
If you really care about your health, this topic will interest you.
We are bringing a lot of important information in this video, so stay tuned.
Welcome to the Brugger Films channel. I'm Anderson.
And I'm Victor, and don't forget to subscribe to the channel and turn on the notification bell. That way, you'll be notified whenever we post a new video.
That's right. Subscribe and activate the bell so you don't forget.
Well, the sedentary lifestyle we lead directly impacts our well-being. Poor nutrition and lack of physical activity contribute to weight gain, and some of this fat accumulates in the internal organs.
And most of this accumulated fat goes to the hypodermis, increasing the layer of adipose tissue. Often, all this fat accumulated in our body is not welcome.
In addition to causing various problems, excessive weight gain can also be aesthetically displeasing to some people. When this happens, many seek quick weight loss solutions. One option is bariatric surgery, better known as the stomach reduction technique. It is recommended for people with a body mass index, or BMI, above 30. An average person has a BMI of around 20. Bariatric surgery is a complex procedure and, like any surgical intervention, it can bring complications. After surgery, extra care is required because the body can become malnourished. This is quite common since food intake drastically decreases due to the reduction of the stomach. Those who undergo this surgery will need to have regular medical exams and nutritional follow-ups for the rest of their lives. Many people experiencing depression or anxiety end up turning to food, consuming a very large number of calories per day.
That's right. And the average daily calorie intake for men is around 2,500. For women, it's around 2,000 calories.
But these numbers are just a parameter, as a serving of cookies can have a caloric value close to the daily average. This parameter is quite difficult to follow, as no one goes around counting the calories of everything they eat in a day. The ideal approach is to burn the excess calories with physical activity. This way, your body will always have a good metabolism and won't accumulate that unwanted fat.
But Victor, what about the famous weight loss medications? Do they really work?
Well, one of the most famous substances used for weight loss is Sibutramine, which is an antidepressant of the serotonin and norepinephrine reuptake inhibitor class. Sibutramine is not used as an antidepressant. It is indicated for the treatment of obesity and binge eating disorder.
But tell me, how does this medication work in our body to aid in weight loss?
When the medication is ingested, it is absorbed into the bloodstream. In the liver, it undergoes metabolism, and its molecules travel to the brain, directly penetrating the neural network. In the neural network, the medication's molecules block the reuptake of neurotransmitters and stimulate serotonergic, noradrenergic, and dopaminergic neurotransmissions. In other words, Sibutramine increases the feeling of satiety, inducing the patient to reduce food intake, as well as stimulating energy expenditure and thermogenesis.
Well, so that's how it is. By acting directly on the neural network, Sibutramine can aid in weight loss, with its effectiveness proven.
I hope you're enjoying the video and the information we are presenting here. So don't forget to leave your like and share this video with people you think will enjoy it. This way, you help the channel continue producing new videos.
Now that we know this medication truly aids in weight loss, what are its risks?
Every medication should be prescribed by a doctor, who will monitor its use to minimize risks and achieve the desired results. The use of Sibutramine can be associated with increased blood pressure and heart rate. Therefore, only a doctor can prescribe this medication. No one should use this medication indiscriminately, and people with hypertension should be especially careful. There are also high-calorie and thermogenic products classified as supplements. These are much safer, composed of caffeine and taurine. However, when consumed in excess, they can also cause insomnia and an increased heart rate.
Let's get back to Sibutramine, which of course is neither a supplement nor a simple energy drink. There are substances that, when consumed, can cause physical and psychological dependence.
But what about Sibutramine? Can it cause physical or psychological dependence?
Well, there is no evidence that using Sibutramine can cause physical or psychological dependence.
All the information we provided in this video is for informational purposes only. This video is not intended to encourage self-medication. But here's a tip. Dieting and physical activity are still the best and safest ways to lose weight. Therefore, always seek a professional to properly assist you in achieving your goals. I hope you are enjoying the video. Comment below if you have used this medication or know someone who has, and share this video, as it is quite interesting. This medication is being banned in some countries, such as Canada and Australia. Since 2010, its sale has also been prohibited in the United States. Sibutramine was the best-selling drug in the world for treating eating disorders. In Brazil, the medication is the most recommended for this purpose. For endocrinologist Aliciane Brandão Leite, the suspension of the substance was a surprise, as it is routine for doctors in the field to recommend weight reduction treatment with the drug. Aliciane asserts that it is a reliable medication, but of course, must be administered and monitored by a doctor. The patient must return after the first consultation. The dosage should not exceed 20 millicalories per day, and the medication should not be used for more than 2 years. However, the endocrinologist does not deny that there can be side effects. The patient may experience an increased heart rate and a reduction in bowel movements. In an interview with Correio Brasiliense, patient Luisa de Carvalho, who had been using the weight loss drug for 6 months, said that Sibutramine has helped her control, especially the anxiety attacks that made her eat a lot. She reports that with the daily effort of controlling her diet and attending the gym, she has already managed to lose 5 kilos. She also believes that the drug is not strong enough to be banned in Brazil.
Don't leave without giving a like and subscribing to the channel. And if you have some time, send us tips on interesting topics for new videos.
Don't forget to follow us on Instagram, Brugger Films, where we always post previews of new productions and everything happening at the production table.
That's it, folks. Take the opportunity to watch other videos here on the channel or stay tuned for the next production.
Well, folks, that's it. See you in the next video.